times I get this question that when should I go start seeing a psychiatrist and when should I see a therapist? Most of our clients in our practices have both psychiatrist and therapist. Some of them begin with a therapist, and then the therapist recommends that, you go see a psychiatrist. Maybe you need some medications. And then some of them start with the psychiatrist, and then the psychiatrist will recommend that you go and see a therapist. Rarely, or in small instances, there are psychiatrists who will see their clients for both therapy and medications. And those are the psychiatrists who may have some extra specialization, some extra training in doing either a specific form of therapy or just a general supportive therapy. But again, such psychiatrists are few. The question is, when should you start seeing a psychiatrist first, and when should you seeing a therapist first? If you are someone who is noticing that they're having severe emotional or mental health symptoms which are almost rendering them disabled, or which are substantially interfering their day-to-day functioning, their day-to-day life. They are having issues with their close friendships and their family members. They're unable to work. They cannot concentrate. They're having ongoing panic attacks. They may be going through severe depression to a point where they are sad constantly. They're feeling helpless, hopeless, guilty. They cannot eat, or they're eating too much. They cannot sleep, or they're sleeping too much. And sometimes a person may be having thoughts of death or active thoughts to commit suicide or to harm themselves. Or a person may be going through some other serious mental health symptoms, for example, mania, in which a person mind may be racing. He may be having ongoing anxiety. Sometimes a person can have delusions, means like he or she thinks that people are after them. They could become paranoid where they're not going to leave their home. They're isolating, they're pushing their friends and their family members away. So meaning that they are having active, serious mental health symptoms or emotional symptoms, and they are looking for an immediate relief with a medication. These are the folks who might have gone to a therapist, but remember, in order for therapy to happen, you have to have some level of awareness, and you have to be comfortable enough where you can actually sit in the therapist's office. You can pay attention to what the therapist is asking you, what the therapist is communicating with you, and you have to be able to share freely your concerns, your problems, and your issues with the therapist. So if that does not happen, because sometimes your mental health symptoms are so serious that it's difficult for an individual to even sit for a longer periods of time because their mind is racing, they're feeling panicky, they're feeling paranoid, they're having hard time trusting the therapist, they're having hard time staying coherent, their thought process is disorganized. Sometimes they could be hearing voices or seeing things which are not there. And in such circumstances, the therapy is not going to work. The therapy is not going to be effective. So at that point, you have to begin with a psychiatrist. So a psychiatrist will do a thorough evaluation. They will take your history. They will ask you questions. And many times, a psychiatrist will also get what's called collateral. Means that they might have you have a family member be present or ask you for permission to contact a close family member who knows you well enough and understands what you're going through, what your day-to-day challenges are. So after doing a detailed history taking, a psychiatrist might also do some testing, for example, some blood tests, and in rare cases, maybe some imaging. And after all the results are back, then a psychiatrist will formulate a diagnosis. So in the diagnosis, a psychiatrist will come up with a condition that, according to the DSM, which is the Diagnostic and Statistical Manual, which is sort of like a collection of the symptoms with which the psychiatrist, so they do like this check mark, they check the symptoms, and then when you meet the criteria for a specific kind of an illness, that's what your diagnoses will be. Now remember, many times the symptoms may be overlapping, or your symptoms may not be pointing to a one particular psychiatric conditions. Like for example, it's easy for a psychiatrist to diagnose panic attacks, panic disorder, anxiety disorder, depression, bipolar disorder, schizophrenia. But many times during first visit, it may be difficult for a psychiatrist to come to a proper diagnosis because again, we don't have a specific test which can tell us what exactly your diagnosis is. Like for example, for neurologists or for other doctors, they see an MRI, they see an imaging, they see a CAT scan, they can locate a tumor, they can see where the stroke is, but psychiatrists don't have those tools. Most of our tools, we have to rely on the history taking. We have to rely on our experience and what the client verbalizes and what the family tells us about that client. So then we formulate a diagnosis. So many times, especially when people have trauma, so if there's an underlying trauma, many times the symptoms of trauma can be confused as to having a DSM diagnosis. For example, there are times when trauma can be confused with a bipolar disorder, can be confused with a psychotic disorder. So there are many different elements to coming to a diagnostic conclusion. So if the psychiatrist tells you, well, listen, I have a feeling that you have a possible depression, but I'm not sure, or I'm suspecting a bipolar disorder. So many times the psychiatrist will begin as a diagnosis with like either adjustment disorder or unspecified anxiety, unspecified mood disorder, unspecified psychotic disorder, means that they're still figuring it out. All right, and that is all okay. So it might take at least 3 to 4 visits for a psychiatrist to come up with a clear-cut diagnosis, and then a psychiatrist will pick a medication regimen for you. And also remember, the medications that psychiatrists prescribe are not like blood pressure medicine. You take a pill, the blood pressure is going to go low. Many times you might need 1 to 2 trials of different medications, or you might need what's called a combination of medications to help you feel comfortable, to help your symptoms improve over a span of time. And then once your symptoms are manageable to a point where you're actually able to sit in the therapist's office, most of the time a psychiatrist will refer you to a therapist. Psychiatrists utilize the use of medicine, most of the cases, to help with your psychiatric symptoms or emotional and mental health symptoms. And some psychiatrists will also do therapy. And of course, now we have different other methods which psychiatrists can use. For example, shock therapy, again, rare cases, or there's a new form of therapy called TMS, transmagnetic stimulation. There are some invasive procedures that psychiatrists have learned to develop over these past few years, like ketamine therapy, which is an infusion called ketamine, which is used to help a person come out of depression. And there are many other ways. Now, the psychiatrists are specialists, and they may have super specialization. There are some psychiatrists who only treat children and adolescents, and there are some who treat adults, and there are some psychiatrists who will just treat elderly people. There are some psychiatrists who have experience in dealing with a certain kind of population, like LGBTQ or women. For example, I have a psychiatric practice, and in my practice I mostly cater to women's issues. But on an average, most of the psychiatrists can diagnose, able to treat most of the mental health conditions. So then there are therapists. Therapists are professionals who use talk therapy. Now, this talk therapy is not like talking with a friend or a family member. No, this is a special form of a talk therapy where a therapist is trained with the help of effective communication, proper wording, proper method, proper mannerism, A therapist is trained to first of all get information from you, and then also to help you identify that what are the areas of concern in your life. That could be your personal life, your professional life, or whatever aspect of your life you are struggling with. And the therapist, of course, is a keen listener. They listen to you and they help you figure out what is going on, what are the problems, and then they help you set up certain goals. Now, a therapist, or there are different kinds of therapists, okay? So there are therapists, or what we call counselors, who have a master's level of education. There are what's called licensed social workers. Some of them have master's level of training, and some of them have doctorate level of training, like PsyD. And there are, of course, psychologists who are also a form of therapist. So psychologists have a PhD or a doctorate of psychology, and they also use, they're specialized in certain kinds of therapies, like trauma-focused therapy, psychodynamic therapy, CBT, EMDR, or exposure response prevention, narrative therapy. So there are all different kinds of therapies, just like you have different kinds of medicine. So these different kinds of therapies are utilized for specific issues, specific problems, which only a therapist or a professional, a psychologist, a therapist, a licensed counselor is able to figure out that what sort of therapy you will be utilizing. So yes, if, say for example, you decide to go with the therapist because you're having some issues in your personal life, like maybe your marriage is suffering, your job is causing you to have a lot of stress, maybe you're noticing that you don't have healthy coping skills to manage the stress, or maybe you're noticing that you're using unhealthy ways to cope with your day-to-day stress. So many times we can begin with a therapist, and sometimes therapy is all we need just to sort of talk it over and learn to develop those healthy coping skills, and get that support from the therapist. And that may be all that we need to be able to live a productive, successful, and healthy life. Like psychiatrists, a therapist is also trained to do a proper history and will be able to diagnose you with a mental health condition, just like a psychiatrist uses the manual, the DSM manual. So a therapist, a psychologist, is able to diagnose you with mental illness or a mental condition. And when they feel that therapy is not enough, or therapy is not helping, or we're not able to proceed with the therapy because there's so much of anxiety, there is paranoia, there is psychosis, there's so much of depression, which is not making therapy effective, in that case, a therapist will refer you to a psychiatrist to help you to be on that medication. Once you're on the medications, the symptoms have settled down a little bit, and then the therapy begins. The therapy is effective. Now, for you to live a healthy life, for you to manage a emotional or mental condition, most of the times, I would say about maybe more than 60% of time, you do need both medications and therapy. Because remember, medications will help you with your mental illness while you're taking them, and medications have side effects, right? So a psychiatrist will always measure your risk and the benefit. If they notice that the risk for medication is too much than the benefit, then they will not give you medications, and they will encourage therapy. When you go into therapy, which means that you're basically using your inner skills, your inner coping mechanism, it's sort of like an exercise for your brain. It's just like, if you go for a knee replacement, so the surgeon does his job, replaces your knee, then maybe they're going to give you some medications to heal, an antibiotic or some painkillers. However, that is not it. After that surgeon does their job, after that comes the work of a physical therapist who helps you to use this knee, to use this new joint, and helps you to gain back your mobility so that you can live a healthy life. You're able to walk and go up the stairs and run your errands and do your normal work. So it's not like, okay, you do the knee replacement or the hip replacement and that's it. Now, after that, there is months of physical therapy which helps you build the strength. The same is for your mental muscles, because remember, your mind is also a muscle. Now, all these these thoughts that go into your head are these impulses that are running through these tiny micro muscles, which we call the neurons. Okay, so yes, you do have to take medicine, which is like that hip replacement, but then you have to do the therapy where you strengthen these micro muscles and then learn how to live a healthy life, how to manage your anxiety, how to manage your mental illness, and that is what we call an effective treatment. That is called the proper treatment. So I hope through this video it clarified the confusion between a therapist and a psychiatrist. And again, I hope that if there's anyone out there who is struggling with a mental or emotional condition, remember there should be no shame in seeking help from either of the two. Start with a psychiatrist if you think your symptoms are serious. Start with a therapist if you think you're able to live and manage your day-to-day affairs, but you're trying to figure things out, trying to, become healthy, learn healthy coping ways, or you're having relationship issues, you're learning how to handle the stress. And if you have both, then that's okay too. And I get it, there is stigma to this. Wisdom is to seek help and to recognize that my mind is like any other part of my body, and like any other part of my body, my mind can also need some help, can also need a specialist, can also need a doctor. So yes, it's a sign of courage to seek help and not weakness. Please take care of yourselves and stay safe. And yes, don't forget to subscribe to receive more future videos on your mental and emotional well-being.